To our 7-week health campaign, this week focusing on breast cancer and the ways it can be treated. After patients receive the initial diagnosis and probable surgery to remove the cancer, they meet with an oncologist to determine the best way to keep the cancer from coming back. Well, our Linda Hurtado asked a medical oncologist from Florida Cancer Specialist how she figures out which treatments will work for individual women.
I think the first time anyone hears they have cancer, it's just like everything falls apart and you can't even really comprehend.
Dr. Julia Cogburn is talking with patient Geneva Grimsley. Diagnosed with breast cancer after a routine mammogram picked up something suspicious, Geneva came to Florida Cancer Specialist oncologist Dr. Cogburn for a game plan on how to make sure that cancer never came back.
Basically, our decision is made on tumor size, lymph node involvement, what the characteristics are in terms of the hormone receptor and HER2 protein, and then we can make a decision with the patient about whether pill-based therapy alone is adequate and reasonable, or if we should add chemotherapy to try to get some benefit.
Dr. Cogburn says Geneva had stage 1 breast cancer, but the pathology report alone didn't tell her whether chemotherapy would help her patient. So she took part of Geneva's tumor and put it through the Oncotype DX test.
That gave us a number score that indicated she was in a high-risk category, that chemotherapy would benefit her and we shouldn't miss out on that.
And with that, we determined that we would have 12 weeks of chemo.
In other cases, a pill-based chemotherapy like tamoxifen may be sufficient, sparing patients these lengthy infusions and the sometimes unwelcome side effects that go with them. In other cases, new drugs, not yet available routinely, can be accessed through clinical trials. Geneva is powering through her particular treatment, feeling at peace with her plan of action.
I never thought anything other than going through this and coming out victorious.
Taking action for your health. I'm Linda Hurtado, ABC Action News.
And next week for our health campaign, we will take a closer look at some of the advances for people diagnosed with prostate cancer.
And tonight